Hello and welcome back to Silvia's Health Hints. Today I will do the first video about mental health. The first subject is burnout. Burnout syndrome is a state of physical and mental exhaustion with a significantly reduced performance, caused by long-term stress at work. Private problems are rarely the only trigger, but are often added as a result of chronic stress in the professional environment. Burnout syndrome was already described in 1974 by Herbert J. Freudenberger, an US-American psychologist, but recognized as a disease by the World Health Organization only in 2019. It is not a fashion disease. In its fullest form, burnout syndrome is closely associated with depression, neurasthenia, which means physical symptoms without an organic cause, and the adjustment disorder. The number of affected people has increased rapidly in the recent years. A family doctor has almost every day to do with patients with burnout, or at least with signs of burnout or symptoms of burnout. Burnout syndrome is highly disabling for the patients and very often leads to long-term, if not to permanent, incapacity to work. The necessary multimodal therapies over longer periods lead to increasing costs for the healthcare system. What are the causes? The main cause is an ongoing stress situation in the professional environment. This can be caused by excessive demands at the workplace, stress, poor organization at the workplace, unclear hierarchies and tasks within the workplace, and/or mobbing. In what extent stress in the workplace leads to burnout syndrome in a person depends to their individual vulnerability, their personal stress tolerance, physical health, lifestyle presence of concomitant diseases, private stress, children, nursing case in the family, and the presence of personal social networks, family, partner and friends. So on one side, it depends on if the person has also other problems, and on the other hand, how much help and compensation is available. Warning signs and symptoms of burnout. One of the first symptoms is sleeping disorder. These results from the increasing inability to disconnect. The person comes home when there's the evening, but cannot disconnect from the working situation. The problems of the workplace are taken home and become part of preoccupations and recurrent thoughts. The result is that the patient are less recovered and so less productive during the following day, which leads to further problems at work and everyday life. So a circuit starts. Symptoms of depressed mood are increasingly observed up to the full picture of depressive disorder, with the typical symptoms of feeling inner emptiness and impotence. In other cases, increasing aggressivity can be observed. These symptoms are usually accompanied by unspecific psychosomatic complaints such as digestive disorders, headache, back pain, difficulty to concentrate, increased susceptibility to infections, skin problems, weight loss or weight gains, sexual disorders, or tinnitus. Some patients develop symptoms of anxiety disorder with panic attacks. After all, the full picture of burnout syndrome can hardly be distinguished from depression and some other psychological disorders. Therapy and prevention. The burnout syndrome should be treated as quickly as possible. Otherwise, it could lead to serious secondary diseases such as depression and anxiety disorder, like already mentioned above. If warning signals appear, you should seek professional help as soon as possible. The first person normally is the first contact person normally is the family doctor. In the therapy, the first priority is the elimination of the causes, which can mean a change of a working place in case of work-related burnout syndrome. Here, of course, one has to consider the realistic possibilities of finding a new job with better conditions. Finding a new job with better conditions is not always possible. A job loss due to recommendation of a psychologist or a doctor as a result of no, sorry, I wanted to say something different. It's not always realistic, it's not always possible. Of course, it is more difficult to learn and develop strategies to deal better with the situation, but sometimes this is the only way. A job loss due to recommendations or as a result of longer sickness can lead to additional stress for the patient due to economic problem and thus aggravate the general situation. So a doctor should always be very cautious with recommendations like, okay, this job is not good for you, this is too stressful, just quit and then we will see. Then we will see it doesn't work normally. Also, I also observed very often that patients were on sick leave for a very, very long period, which makes the coming back to work very difficult. It's necessary and it's okay to take a break, to recover, to rest, but then a plan needs to be done how to resolve the problem, because more longer you are on sick leave, more difficult it is to come back to a situation which was stressful. Rather, after an appropriate but not too long rest period, the patient should be given psychotherapeutic support to learn how to deal differently with the given situation. The time out should bring sufficient recovery, that's what I was talking about, but should not take too long. Experience shows that the longer the patient has been taken out of work, the more difficult it is to re-enter. All this could not be possible in case of mobbing. The pillar of therapy should be psychotherapy. Cognitive behavioral therapy has shown to be the most suitable. However, other forms of psychotherapy are available. If it seems realistic, the patient should be helped in finding a new job, but like I told, only if really this is possible. The personal professional goals should be reconsidered, and if necessary, more flexible working time models should be considered. If a change of job is not possible, the patient has to learn to deal better with the given situation. This includes paying more attention to his own needs, learning strategies for stress reduction, using social resources, partners, family, friends, and cultivating hobbies. The situation in the workplace should be improved, if possible, in cooperation with the superiors by better time management and adjustment of career planning to more realistic goals. Accompanying, the patient should be instructed by the attending doctor how he can strengthen his health through healthy lifestyle, regular physical activity, adherence to rest breaks, healthy eating and sufficient sleep make us more resistant to psychological stress and the development of burnout syndrome and other psychological disorders. The use of drugs, pharmaceutical treatments should be limited to very severe cases and should only be used for a short time. It's a very complex subject, but it's something that I think that maybe not in the full expression, but like warning signals or some symptoms of a possible burnout, I think that everybody of us experience at least once in his life. So I think it's a very serious and problematic subject, also because, like I said, it's not always possible to change our working conditions. and it's very, very difficult to learn to deal with it. I hope it was a good introduction in this subject. To conclude this video, I would say that take seriously all warning symptoms, all alarming signs, and search for help as soon as possible. Thank you very much for watching this video. We see each other next week.